Hi there, this is Nursing Education Videos. Today I will be going over multiple sclerosis, MS, NCLEX review on registerednursRN.com. I will be reading the review notes and I hope it helps. All credit for this information that I am reading goes to Sarah at registerednursRN.com. Again, all credit for the information that I am reading goes to Sarah at registerednursRN.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. Multiple sclerosis NCLEX review for nursing students. This review is part of a neuro review, so be sure to check out those other NCLEX reviews. Don't forget to take the multiple sclerosis NCLEX quiz. What is multiple sclerosis, MS? It's an autoimmune disease that affects the myelin sheath of the central nervous system, CNS. This leads to the inflammation and scarring of the nerve, which causes a decrease in nerve transmission. This is why many patients experience sensory and motor problems. Quick facts about multiple sclerosis. It's an autoimmune condition, which means the immune system is actually attacking the myelin sheath found on the nerve. It affects the nerve cells in the brain and spinal cord, and this leads to many sensory and motor type problems. Symptoms vary among patients because different areas of the central nervous system are affected. For example, if the patient has lesions, damage to the myelin sheath, in the cerebellar area, the patient may experience tremors, dysarthria, which is issues with articulating words, muscle for speech aren't working well, ataxia, trouble controlling body movement, and cognitive issues. Furthermore, if the nerve to the eyes, such as the optic nerve, is being affected, the patient will have vision issues like blurry vision, or blindness in one eye, etc. Women tend to be affected more than men, and MS seems to show up in the age category of 20 to 40s. Symptoms can appear and then disappear. This is the most common form of MS, where signs and symptoms come and go, called relapsing remitting multiple sclerosis, RRMS. Exact cause is not totally known. There is currently no cure, but there are lifestyle changes and medications that can improve signs and symptoms. How is multiple sclerosis diagnosed? Diagnosing takes time. The neurologist has to assess several things because there is not one test that can diagnose it. Assessing patients' symptoms may need to rule out other diseases. An MRI to assess for lesions in the brain and spinal cord. Lumbar puncture assesses spinal fluid for specific proteins called oligoclonal bands, which are immunoglobulins. If these are present, it shows there is inflammation in the central nervous system. Evoked potential studies. These send electrical signals to the central nervous system and sees the response. So the pathophysiology of multiple sclerosis. You have to understand the anatomy and physiology of nerve cells, so neuron, in the central nervous system. First, dendrites. They receive the signal needed to create some type of action. This signal goes down to the soma, which means body, and this structure helps pass on the signal it just received from the dendrites to the rest of the neuron. Then, the signal goes down and passes where the soma of the neuron and axon connect as at the axon hillock. Then, the signal goes down this long area known as the axon. For the axon to be able to deliver the signal properly to either another neuron, muscle, or gland, it must be insulated and protected by the myelin sheath, which is made up of Schwann cells. These cells consist of fats and proteins. This is our problem with MS. the myelin sheath has experienced demyelination. So guess what? The signal is not being transmitted properly to the area that the nerve supplies. So there's a picture here that says nerve affected by multiple sclerosis, decreased nerve signal transmission. After the signal leaves the axon in a healthy neuron, it goes to the axon terminal, the end of the axon, where it synapses, where a nerve signal passes with another neuron, muscle, or glands to cause an action of some type. So, in MS, we're talking about the nerve cells in the central nervous system, which is our brain and spinal cord. Because of this, we can expect to finding sensory type problems such as touch, vision, coordination, emotional, cognitive, and bowel/bladder issues. For sign and symptoms, let's divide them by category. Remember, signs and symptoms vary in patients depending on where the lesions have occurred due to demyelination. Signs and symptoms of multiple sclerosis. First, emotionally and cognitive. You feel drained, feel weak, fatigued, depressed, trouble articulating speech, issues swallowing, mood swings, trouble thinking, focusing, solving, keeping thoughts, etc. Next, sensation issues, involuntary tremors, spasms, which are painful and strong, clumsiness, leads to unintentional injury, numbness/tingling, face and extremities. Electric shock sensations that travels down the body when moving head or neck in various positions called Lieberson sign. And other symptoms. Dizzy, muscles hard to move, where it's stiff, affects coordination, cerebellum area. There are also symptoms of being unable to be aware of body position. Proprioception, when eyes are closed, Romberg's sign. Patient puts feet together and closes eye. This causes them to sway. Next, vision. Nystagmus, issues with controlling eye movement. Optic neuritis, where it's early double vision. Blurry vision, or vision is gray, dull colors. Blindness in one eye, and seeing dark spots in vision, painful when moving eyes. Elimination, nerves are affected that control the bladder/bowel and the sphincters. Can't hold urine, overactive bladder, incontinence, leads to nocturia. Problems urinating. Hesitancy leads to retaining urine, which is at risk for UTIs and renal stones. Bowel, constipation/diarrhea or incontinence. Early signs and symptoms of MS include vision issues, tingling, numbness, weakness, dizziness, balance issues, bladder problems, cognitive issues speaking, weakness, spasms. And in asterisks here, symptoms can get worse due to heat called Authof's sign. So Authof's sign. Heat can be from the weather, physical exercise, etc. Nursing interventions for multiple sclerosis. Nursing considerations. Safety, where it's vision, coordination, decreased perception with pain. So these are being concerned of the patient's vision, their coordination, their decreased perception with pain. So RRMS, which is the most common form of MS, which is the relapsing, remitting multiple sclerosis. Preventing symptoms from worsening. is also another nursing consideration. Bladder and bowel issues and medications. So consider patients' bladder and bowel issues and their medications. Preventing symptoms from getting worse. Watch the heat. Keep room cool. Avoid heating blankets, pads, etc. Avoid infection, stressful events, and getting too tired. Overexertion. Pace out activities and take time to have many rest periods. Very important to maintain regular exercise as tolerated. Not too much because it can exacerbate symptoms. So swimming, water aerobics keeps energy and mood level up. Use assistive devices to help with walking and preventing injury, such as toileting and showering. When symptoms are presenting, clutter-free environment. So I think this means use assistive devices to help with walking and preventing injury, as well as toileting and showering when symptoms are presenting. Create a clutter-free environment, especially when vision affected or experiencing vertigo. Scan the environment if experiencing blindness in one eye or dark spots. Consult speech-language pathologist. Helps with speech if speech is slurred or hard to understand, difficult swallowing. Physical therapy, exercises, assistive devices. Support groups with others who have multiple sclerosis. Bladder and bowel. Make accessibility to the bathroom easy due to overactive bladder. May need to learn how to self-cath if retaining urine. Plenty of fluids to prevent stasis of urine and to keep it from becoming too concentrated, 1 to 2 liters. High fiber to prevent constipation. Stool softeners. Medications for multiple sclerosis. Medications vary depending on what symptoms the patient is having. Medications treat symptoms, don't cure disease. Beta interferon decreases the number of relapses of symptoms by decreasing inflammation and the immune system response. Causes risk of infection because decreases white blood cells. Drug names: Avonex, interferon beta 1a, Rebif, betaferon. Next, corticosteroids for relapses of symptoms. Methylprednisolone, so Solumedrol, and prednisone. For bladder issues, oxybutynin. It is an anticholinergic that helps with an overactive bladder. Relaxes bladder to prevent contractions. Bethane chol. It's a cholinergic that helps with completely emptying the bladder by helping bladder contract fully. If patients are having fatigue, amantadine, which is an antiviral and anti-Parkinson, but has central nervous system effects. This helps improve fatigue in MS patients. Another drug is modafinil. It's a CNS stimulant. For spasms, there are baclofen. It's a skeletal muscle relaxants that act centrally. Diazepam. For tremors, propranolol. It's a beta blocker. Isoniazid. It's an antibiotic used to treat infection, especially TB. Helps with certain tremors in MS. References: Multiple Sclerosis Diagnosis, Genetics Home Reference, retrieved 9 April 2018 from ghr.nlm.nih.gov/condition/ multiple-sclerosis. Number sign DIAGNOSIS multiple. So I think the reference website is actually ghr.nlm.nih.gov/condition-sclerosis, number sign DIAGNOSIS, and it's called, and then it says multiple sclerosis fact sheet 2010 page 1. Next reference is multiple sclerosis NCCIH, retrieved 9 April 2018 from /healthiple-sclerosis. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursern.com for more information and check out their YouTube channel. Thank you again, and I hope everyone has a great day.